I guess we think of prescriptions as being something medical a lot of the time. For me, social prescribing is about looking at the whole person. I was diagnosed with breast cancer during the pandemic, and intuitively I went to nature, and it really rerouted me in that understanding of nature as something that can hold us and teach us and help us to heal. Usually life is really busy for people, they've got a lot going on, so we just take a little bit of time together just to sit and breathe and let go of the stress of the outside world, and just so people have that sense of the next few hours being about them and their relationship with nature and being here. And then we might go for a walk out into the woods. Sometimes we forage for leaves to make tea, collect things to do nature crafts. There's an opportunity to do things like whittling, a bit of green woodworking. It's different every time.
Hi, I'm Claire Reader and I'm a GP at Hilltop Surgery on Fitton Hill, and I've been working with Northern Roots for the last year and a half. When I talk about social prescribing to patients, I talk about things that might not be a prescription, like a medication or a referral to another doctor or service at the hospital. I talk about things that could be helpful to them that might be in their local community, and I explain that there are less side effects and maybe different things and ways of thinking about helping a problem that hasn't already been tried before.
There's a huge body of evidence that being active and engaged outdoors is beneficial, and it's particularly beneficial for mental health, stress, anxiety, social isolation, which are growing problems throughout our society, and also for getting people more physically active and helping with things like diabetes, weight control, cardiovascular and lung conditions.
I think the Natural Health Service is brilliant. I think it's thinking outside the box, and I think if everyone could have one on their doorstep, it would be brilliant.
Hi, I'm Faiza and I'm a Community Outreach Coordinator for the Natural Health Service. So I'm connecting with the local ethnic minority groups that I've worked with previously, such as GMSOR, which is a Greater Manchester South Asian Women's Group, BAME Connect, Chai Women's Project and Fatima Women's Project, along with a few others that we've just started coordinating with.
So I wanted to work with the Natural Health Service because I quite like the idea of bringing nature and health together, and just seeing and exploring ideas on how nature can actually help people heal mentally, physically, in their wellbeing journeys.
Speaking as a South Asian woman and working with the South Asian women's groups, there's a lot of interest around growing and herbs and cooking and the outdoors. I think it's really necessary for mental health. There are a lot of issues within our community that are not really addressed. It's brushed under the carpet. It might be discussed in a doctor's surgery, but it won't be discussed sort of socially. And I'm a South Asian woman, I can relate to a lot of the issues. I'm bilingual, I can speak for the ladies who couldn't speak English, I can communicate in Urdu, and I think that brings out an element of trust as well and familiarity.
I think the Natural Health Service could benefit literally anyone from any background, any walk of life, because nature is a part of everybody's lives, so everyone can use it in their own ways.